Well, thank you so much for coming. My name is Marie Lowe, and I'm a faculty member here at ISER, and I'm honored to introduce today's speaker, Kent Spiers, former and star UAA sociology student, ISER intern, and commencement speaker. After Kent left UAA and his illustrious career here, he moved on to complete a master's degree at Lakehead University in Ontario with a thesis entitled Northern Exposure, a comparison study of Alaska and Yukon models of measuring community well-being, which he'll be presenting here today. Currently, Kent is pursuing a doctorate in anthropology at the University of Calgary, where he's focusing on resource development and the relationship of northern communities, between northern communities and their environment. We're just thrilled to have you back, Kent. And so I'd like you to just please give him a warm welcome. So one thing before we get started, I'd just ask if everybody could hold their questions until Kent has finished his presentation. Thank you.
Thank you, Marie. Well, thank you, Marie, for the introduction. It's always nice to reflect on some of the things that I was able to do here at UAA and what I've been up to since. I forget what I've been up to. And I want to thank all of you for coming out here today, spending your time from your busy schedules to hear what I have to say. And those of you that are live streaming and get to see my beautiful bald head throughout most of it. So what I'm going to be doing today is I'm going to be walking you through the master's research project that I did, and then I'm going to be talking to you a little bit about the PhD work that I'm doing now. I'm in my first year and a half, so I've been focusing mostly on my requirements for the program, but I've had some pretty cool leads on what I've been doing. Actually, before I get started with my talk on my research, I just wanted to take a moment on a personal note to talk about 2016. For a lot of you, you know that 2016 has been a very challenging one for myself and my family, as well as many other people. And back in January, I think it was, of this last year, something that I wanted to do for my dad, who was going through chemotherapy, was to create this Selfies for Ken campaign, where people could take photos, have a little note, say something to him, because, you know, all the sympathy cards that you see out there are they're pretty depressing, and not something you want to keep reading over and over again. So I put that out there, I put it on Facebook, and happy to say that ISER was there to send me a photo. And the idea behind it was I was going to create this book, and he'd have the book that he could flip through and he could look, and when he was having a good day or a bad day. And this picture over here is him, my mother showing him the photos on my iPad. And unfortunately, that's the last time I saw him. And when he got to the ISER photo, he chuckled and said, "You worked with these people?" Yes, happily, I worked with these people for a while. So I wanted to thank ISER for doing that for me and for him, so that he had the opportunity to see that. Something that also we've been doing, and I just wanted to announce, there's two big things that have come out since he passed in February. We've been raising money for renovation for the hospital in Fort McMurray, and we created a foundation in his name. And so far, we've raised over $3,200 in his name, so that's quite good. And another thing, my father worked for Shell for a number of years in Fort McMurray, one of the sites, and they just sent me an email saying that one of the roads that was beautifully named RW8267 3-West or something, they've now renamed to Ken Spiers Way. So I thought that was a great tribute and something that he would really like. And so 2016, you know, really wanted to continue to challenge me and many other people. So our challenges didn't end at the passing of my father. On May 3rd, as many of you had probably seen, the fire nicknamed the Beast raged through the city of Fort McMurray, and over 88,000 people had to be evacuated, were evacuated, safely evacuated. There were absolutely no casualties from that evacuation, which was incredible and really great to hear. And my mother and brother, two people in the 88,000 that were had to escape, made their way out of town. Normally takes 4 hours to get to the next big city, which is Edmonton, capital of Alberta. There'll be a quiz later. And it took them 13 hours to get there, just because of the amount of traffic and congestion that was on the highway. And the day after that, them, along with 8 other people, made their way to our house, which is a small house, lots of love in it, but a little small, and ended up living with us for a while. And the outpouring of support was truly incredible from not only across the province, but across the country and as well internationally. And of course, ISER was there, and I want to thank you all for that. The donations and gift cards have been really great for helping both my mother and brother rebuild and resettle into their new homes. And so yeah, this is a photograph of the house that was left, and that's just another one as well. And as you're driving into the city of Fort McMurray during the evacuation period, there was 5 phases in which people were allowed to come back. A number of firefighters lined up the bridge and had the flags hanging there, so I thought that was a nice tribute. But just wanted to take a moment to thank you all for that in person, for your kind messages, donations, and all of that stuff during 2016. So 2016 is going to be a hell of a party. That's all I have to say. Okay, so now I'm going to talk to you about my master's project. And really, the idea for this project came out from another ISER talk that happened here, not this building, but happened in 2013 when Chris Southcott from Lakehead University came and did a presentation on his project, Resources and Sustainable Development in the Arctic, called RESDA. I met with him after his talk because I had a number of Canadian questions that I didn't want to bore my American colleagues with. And through that, we were talking a lot about the things that I have been interested in, the things I have been doing, things on well-being, the Kids Count project and the state of children across the state, and a couple of other things that I had done. And he asked me if I was interested in working with him and getting a graduate degree from Lakehead, or I like to call it the Harvard of the Canadian North. And I can remember I rode my bike home that day and got home, and I said to my partner Eric, I said, I really got this great opportunity. I can go and work on this project, get a master's degree out of it, and how do you feel about moving to Thunder Bay? Where the hell is Thunder Bay? So, needless to say, after a little while of talking and figuring things out, we drove all the way from Anchorage to Thunder Bay, which was 3,189 miles in a Honda Fit with 2 little dogs, 2 bald men, and we made it there in a week and stayed there for a number of months to work on this project. So quickly, what is RESDA? I think it's important to sort of situate what that is before I jump into too much of what this is. So what RESDA is it's a social science project. Number of people at UAA and ISER, I shouldn't say a number, but a few people at ISER and UAA. I know Matt has worked on some RESDA stuff. And the simple objective of it is to find ways to try to increase the benefits that northern communities get for resource development and reduce or eliminate the costs. And so, as we know, and preaching to the choir here, we know that when there's development in the north, especially in these small rural communities, the majority, the lion's share of the wealth and the benefits flow south to larger regions, and it sort of leaves smaller communities with a few more challenges. And so RESDA is trying to find ways to further understand the resource curse, as we call it, and to find ways to mitigate that. So there are 4 themes within RESDA: sustainable cultures, environments, communities, and regions. And so my project The Northern Exposure Project falls within sustainable communities. And I just have to say, I was at a conference at ArcticNet in Vancouver, and I had a young man from a university on the East Coast came up to me and said, well, I'm really interested to hear what you have to say about the contaminants that northern communities are exposed to. I said, what are you talking about? He said, well, northern exposure, isn't it exposure to contaminants? I said, no, it's actually a play off of a TV series that I used to watch about a fake Alaskan town, and he was way too young to understand what I was talking about. Okay. So the research question that I came up with was, what are the similarities and differences in models of measuring community well-being in Alaska and Territory of Yukon? And what was the level of local input used in the construction of these models? And my motivation for trying to understand how we could answer this question and trying to form this question actually came out of conversations that I had with Virgin and DeWalker on this notion of community well-being and models of measuring community well-being. I had attended Anchorage Economic Development Corporation meeting on Live, Work, Play, and there were a lot of questions that I had out of that meeting, and I'll get into that model a little bit later, but that's sort of where that came from. So really, why do we care about this idea or this notion of well-being, especially at the community level? Well, research suggests that communities that are successful in establishing an agreed upon model of measuring community well-being will benefit from local ownership of community affairs, such as greater decision-making, larger capture of material wealth, and the empowerment over resource management, which again falls back into the objectives of RESDA and what it's interested in looking at. And so my thesis highlights the need to further investigate these models in the Arctic that address the clash between mainstream and indigenous measures of well-being, the lack of accurate and longitudinal data, remoteness, lack of infrastructure, and small population sizes, which again, I'm preaching to the choir, you're all well aware of those issues. They're certainly not new, but they continue to exist, and I think that's really the big question as to why they continue to. So why study Alaska and Yukon? That's a question that constantly comes up for me when I'm at conferences or talking with other students about this. And I don't know if I have a really great answer. I lived in Alaska for a while. I loved living in Alaska. Incredible place, incredible people. I lived in Yukon for a while as well. And so I was just very interested in understanding more about the background of how things work in both regions. And you know, there's this interplay between 4 levels of government. You have the U.S. federal government, the Canadian federal government, the state of Alaska, and the Territory of Yukon. And so, since the regions are so close to each other, the neighbors, I thought it's really interesting to find out how different things play out, as well as how similar things play out. As well, we know that indigenous populations have lived or live in Alaska and Yukon, and that this imaginary border, which isn't a wall, hopefully will never be a wall, doesn't really exist within that understanding and that sharing of knowledge, that social bonds that exist. And so I wonder how are those government structures affecting that. I wouldn't say that I've necessarily uncovered all of the answers to those, but that's really where my interest lies and something that I continue to look at as I move forward with my other work. Okay, so what is well-being? This was very interesting to me. I spent a long time researching this. In fact, when I started researching the notion of well-being, I stopped shaving. My beard got down to here, and Eric was chasing me with a pair of scissors trying to cut my beard off, because it was about time I shaved, because it just took that long to try to understand where this notion came from. And really, it's been around for a long time, but it's only been within the last 40 to 50 years that we've focused on this notion at such a global scale. The origins of this concept come from 2 philosophical perspectives, the hedonic and eudaimonic approaches. And hedonic came out of 4th century BC, And the argument was that the goal in one's life ought to be to experience the maximum amount of pleasure, so hedonism, hedonists. And then eudaimonic was coined by Aristotle, who said that life ought to be about living a virtuous life and refuted hedonism as a vulgar ideal, making humans slavish followers of desire. So it's interesting. And from that, we developed this subjective and objective well-being. Subjective well-being is understood as feelings and levels of satisfaction that people experience. Objective is centered around capabilities, individuals' ability to pursue and realize the goals that they value. Fair allocations, various non-monetary dimensions of quality of life in a way that respects people's preference and thus determining whether people have the quality of life that they want. And so there was a great figure sort of put out into how these two branches, well-being branches off into subjective and objective, and sort of how that could be conceptualized. And in more contemporary times, we've seen milestones that have really brought well-being to the forefront. Interestingly, it's argued that NASA is largely responsible for bringing the attention of social indicators as it really wanted to understand the impact that the space program would have on society. And then in the late 1960s, the Department of Health, Education, and Welfare called for well-being to include health and illness. In the 1970s, we saw the social indicators movement to include both economic and non-economic indicators of well-being. The WHO began work on demedicalizing health and encouraging governments to consider a wider range of factors that contribute to poor health beyond disease and its absence. And the king of Bhutan, I believe that's how we say it, actually came up with the concept of gross national happiness. So that was interesting to see that. And then really the country that's at the forefront of this idea of well-being and measuring it is Australia. They've created an Australian National Development Index, which includes subjective and objective measures, and I think they produce a sort of outlook every couple of years. And the French Commission on Measurements of Economic Performance and Social Progress released a report advocating for subjective and objective indicators of well-being. And really, quite frankly, there's a lot of examples around the world, including the ones that I'm going to be talking about today in Alaska and Yukon. And really what we're seeing as we look back, just how this multidimensional construct from hedonic and eudaimonic has developed into what it is today. So for my study, how I defined well-being is actually from the Center of Spirituality and Healing. It's the combination of social, economic, environmental, cultural, and political conditions identified by individuals and their communities as essential for them to flourish and fulfill their potential. And so what is a model? It's a big question everyone always asks me right away. What is a model? And I say, just hold on, I'll get to it. This is sort of a light model that I created for my thesis that just sort of worked to conceptualize it and frame it within the study. You start with defining what local issues community residents or industry want to address, move into measuring it, discussing how to measure it, develop and build indicators that could potentially measure the well-being of a community, then figure out how to manage it after the analysis has been done, report findings to stakeholders and seek suggestions for improvement, and then work on acting or refining based on these suggestions or implementing changes if it is so felt that it's necessary at this time. And we see that this continues in this pattern over and over again to address other issues or continue working on the same one. Okay, so my methods. How the heck did I try to figure out this models of measuring community well-being between Alaska and Yukon? It was a three-step process for me. The first one was just an assessment of the level of input and identification of key words of community well-being. The second one was an experimental content analysis, and I'll get into why I'm calling it experimental. And then the last was qualitative interviews that I conducted with a number of people here in Alaska as well as in Yukon. No, okay, so step one. So in trying to understand this level of local input and how residents were consulted in the process of developing the said models that we'll be looking at, I did an extensive literature review. I pulled out keywords from a content analysis. There was about 85 that I had pulled out that were related to community well-being that kept reoccurring. I looked at whatever publications I could find on each specific model, whether it was newspaper articles, background information in the appendices of the model. And then the last thing, because quite honestly, a lot of these models didn't really talk about how people were consulted, how they came up with their definition of how the community should be measured. I asked the respondents, one of the criteria for each respondent was that they had to have some experience with one of the models in order for me to do an interview with them. So then the step two, I went through each of these models and conducted an experimental content analysis. And why we're calling it experimental is because these models range in size, range in the number of words that each of them contain. So it's not quite fair to compare a model that has 10,000 words versus one that has 1,000 words or 2,000 words. But I still thought it was an important exercise to go through because this is a typical thing social scientists do. We do content analysis of keywords, and we come to conclusions based on that. And I think as this analyses of models continues, and we're seeing more of it all the time, this is something that can be replicated and improved upon as models become public knowledge and are freely available, because we are seeing it's really hard to find models of measuring community well-being. They do exist, but it's hard to find ones that could be freely looked at without going through a very lengthy process to gain permission. So there was a total of 57 key words that I boiled down from my original 80 that I then boiled down to 12. And so, like for example, Aboriginal people over here contains Alaskan Native, First Nations people, Métis, Indigenous people, and I tried to narrow it down because I thought that would be a really huge graph for anybody to try to look at. And as you can see, research was the number one. 2,833 times that word was mentioned within these models, and slowly went down. We have sustainability and resiliency, community well-being, community services, employment, natural resources and development, education, health, culture, social ills, and community or government vision. And I found that interesting. I found it very interesting that the least, or the smallest number of frequency counts, how many times this was mentioned, was community or government vision from these models, which were essentially a community or government vision. And it just wasn't really something that was talked about within these models. So I thought that was interesting. So step three was qualitative interviews. As I said, I conducted 8 interviews. It's a really good idea to conduct interviews with people in the summertime. Kidding. Nobody wants to talk to you in the summertime. They're out enjoying the sunshine, fishing, hunting, and all that stuff. But regardless, I did get it done. I did want to do an equal share between Alaska and Yukon. Didn't quite work out that way. I was able to talk to 6 people in Alaska and 2 people in Yukon. They were semi-structured interviews. I didn't want to make them too rigid because there were people had more experience with certain models than others. So I wanted to dig in a little bit further. And we talked about this general idea of well-being. I asked specific questions about specific models and their knowledge about it, and then just their overall impression on measuring well-being. The questions range from how would you define community well-being? What kind of indicators do you think are needed to measure? And do you think it's important that this sort of enterprise is being conducted? Recruitment strategy, I went to the former ICAS meeting, which was in the gem city of the provincial north of British Columbia, Prince George. If you've ever been to Prince George, you'll know it's not a gem, but I was there with Marie. It was great. I was able to recruit and talk to a lot of people at that meeting, and from that it was somewhat of a snowball sampling. You know, I'm looking at this model. Do you know anyone that would be interested or would be able to talk to me? And it sort of went from there. And then in true social science methods, I transcribed and coded these conversations into themes: community well-being, indicators to measure well-being, social ills, culture, Aboriginal peoples, education, and employment. So this chart shows you the people that I spoke to, gender, region of study, and their occupational background. And it was not chance that most of them are named after Golden Girls characters. I lived vicariously through that TV series. So, full disclosure. Okay. So, what models did I look at? I looked at Eagle Gold Project in central Yukon. I looked at the Yukon Social Inclusion and Poverty Reduction Strategy, the Community Well-Being Index, which was it's a national snapshot carried out by Aboriginal Affairs in Northern Development Canada, which is now, after the Harper reign is over, it's now the Indigenous Affairs and Northern Development. I believe the name has changed, but and I'm not sure the status of this project at this time. I looked at the shareholder employment at Red Dog Mine, which Sharman Haley wrote about. We talked extensively about that throughout forming this study. The Live, Work, Play, as well as Destination 2020 here in Anchorage. And for today's purposes, I'm going to talk to you about Live, Work, Play and the Yukon Social Inclusion and Poverty Reduction Strategy. Okay, so I'm going to invite you to sort of travel back in time with me to 2013. This was the Live, Work, Play metrics that had come out at that time. I understand that it has changed now, but this is the project that I'm finished with, so I didn't go back to reanalyze how it has changed. But this is what it looked like at the time. There are 39 indicators broken into the themes of live, work, and play. And one of the questions that came out of the meeting that I went to, and there was some talk with other colleagues about it, is sort of how do these metrics get decided to fit within live, work, and play? And there really isn't any background as to the thought process behind that. We see that in the live category, I don't know how you can see it. The live category, there's one indicator on 8th grade reading proficiency. Within work, the percentage of the population above the poverty level. Within play, the number of playgrounds per 10,000 residents. Also, the number of healthy days being outside. You know, and I don't want to downplay the work that's been done by the ABC. I think it's a worthwhile venture, but there was just some concerns as to how the decision of how these certain indicators were put into these different themes, as well as what they mean. I wasn't quite sure what +2 or -2 or -3 or 8, 3, and 11 meant. And I couldn't really get answers from it based on that or the website or anybody that I had spoken to at the time. Yeah, so that was interesting, and it you know, it raises questions from a social justice perspective about you know, the discussion about how many people are living within poverty, chronic poverty, or proximity to large-scale development projects, and as well as one of the things that I think Anchorage should be really proud of, and a lot of people are proud of it, is the diversity in the city of Anchorage. The work of Dr. Chad Farrell highlights that within one census, I believe it's a census tract here in Anchorage, is the most diverse census tract in the nation. That's great. I think especially for welcoming newcomers to the city, that's important to highlight and not something that was talked about in here. The feedback from one of the interviews that I did was that there was very little consultation, that when approached to the powers that be about this model, there was no willingness to discuss or to amend which indicators were in the thing, and it's also very limited as it's only quantitative in its outlook. And the other comment from it was that the representation on the board was male, white, privileged. We didn't see there was no diversity necessarily within the workforce that was put into this, which I think could be problematic, and maybe perhaps how some things were missed. But it all might have changed. As I said, this is a little bit back in time for when I was looking at it. How am I doing? Okay, so the Yukon Social Inclusion and Poverty Reduction Strategy. There's a total of 64 indicators in this strategy within 15 sub-themes. It's both quantitative and qualitative indicators. And when I first read this, I thought, this is the gem. This is great. They looked at everything within the territory of Yukon, and was talking to one of my respondents about it and said, yeah, isn't this great? Tell me, what are your impressions of it? I hate it and it should be burned, is what they said. I was totally dumbfounded by this, and really what it was coming from was perspective of Aboriginal people living in Yukon, I guess, had been working to develop a poverty reduction, social inclusion strategy for years, and had sent it to the territorial government, never got a response, and were never consulted on this model. And one of the big concerns was that within this snapshot, there is the proximity to health facilities, mental health opportunities within rural communities across Yukon. And as you can understand, there's not a very good proximity, or there's no mental health facilities that exist there. And so it makes that community look bad, even though the community wants it, the community has advocated for it. Funding issues prevent that from, we can't build a hospital everywhere, but it really paints a dark picture, is how this respondent talked about it. And so one of the things that I often get asked about when talking about this is health. When we talk about well-being, we talk about health. It just seems synonymous with each other. And so I just pulled this out of the data. I brought up this frequency count just so you could see it again. And what's interesting, and I don't think it's shocking to anybody, but when looking at the US context or Alaska context of health, the measures of health were about the people who were insured, who had health insurance, versus in Canada, it was proximity to healthcare providers, the number of staff, no discussion of health insurance, and obviously we know because of the universal healthcare that exists in the country, that's probably why. And I'm not sure how things might have changed with the Affordable Care Act after this analysis was done. I'm not sure how long it was before the Health Care Act came into play. And the other thing that was shocking when talking about health was one individual said, who lives in a rural community in Yukon, said, I think everyone in my community is depressed. Everyone has suffered great challenges, and there's no access to mental health facilities. And the chronic depression. It's not just an individual concern, but as we know, community as well. We need to have trained people to actually deal with the trauma that we're going through. We have suicide, alcohol, very risky behaviors, and chronic diseases. We need education, and then start implementing our own cultural ways to address these issues. And again, when looking at health, there was no discussion in the models of using traditional or Aboriginal ways to address any health concerns. It was all Western science, which is problematic, as we know, for a social inclusion strategy. So my overall results, I'm not going to blow any of your hair back by this, blue line off. What I did find is what we typically expect to find, that most of these models use limited or no local input. Community members need to be included in all aspects of the model design. Those not consulted not only felt resentment, but rejection of these models. Models need to incorporate both objective and subjective indicators such as GDP, income, self-reported levels of satisfaction with community services, as well as happiness and worry. And those would be agreed upon indicators from community members. And again, that there is growing tension around the lack of direct action and funding to improve local living conditions. It's been talked about a lot. These meetings can be quite heated. The conversations can be quite heated with people saying that, you know, we've talked about this for years and nothing is happening, or at least they feel that nothing is happening. And so, anyway, I did this project and it sort of wrapped up. That's what I found, and I'm moving on to my PhD research, which has elements from my master's research. And what I recently discovered on a trip to the province of Newfoundland, which is just off the east coast of Quebec, was this Shorefast Foundation. And I was there, I was talking to community members. That's what sociologists, when we show up in your community, we're going to stop you, we're going to ask you questions, and just get to know what's going on in the community. And what Fogo Island is actually right here, very tiny little island over here. There are 3 communities on Fogo Island, and the population is very small. I'm not sure of the numbers. And Fogo Island was at one time a huge enterprise for cod fisheries, just like Newfoundland itself. And as we know, the cod fisheries had collapsed, and people didn't have any employment. There were no jobs at all. Children were leaving in droves. They didn't want to live on the island. There was nothing for them to do, and the community members were seeing their community shrink, and they were rather concerned and didn't know what to do about it. And so there was a community leader on Shorefast. Her name is Zita Cobb, and she's from there. Her family is from there. I think she's 3rd, 4th generation from Fogo Island. Came up with this idea of creating the Shorefast Foundation. It's a registered charity since 2013, and it uses models for economic and cultural resilience. And these models are based on social engagement, strategic investment in community capital, and inclusive local economies. So when I talked about the findings that I found in my master's research about community members need to be consulted when developing a model for community well-being, I went to Fogo without really looking at, or intentionally looking at this, and I went, it seems like this is a model that's working. We're actually seeing recommendations that come out from research that's been done, and this is an example of it being done and it working. I think oftentimes in our findings and our recommendations, we state them, but a lot of times we don't necessarily see them happening. And so when talking with the people of Fogo Island, I didn't talk to all of them, talked to a number of them. The Shorefast Foundation is their foundation. It's not Zita Cobb's. It's not someone from mainland Newfoundland or St. John's. It's not from the federal government, it's theirs. They talk about it as it's their own. And so they've made investments in sustainable fishing. They got rid of the long nets that just troll the ocean floor and kill everything. They've developed ways in partnership with universities to create these cod pots, which doesn't kill any of the fish, and it separates the bycatch. And they really invested in ecotourism. This is the Fogo Island Inn photo I took there. Beautiful building. You can stay there for the very affordable price of $1,500 a night. Such celebrities as Justin Trudeau, Gwyneth Paltrow have been there this year. And I was talking to one fisherman about his work with the cod pots. His wife actually greeted me at the ferry terminal on mainland Newfoundland. I didn't know this until I went to her house. She works for the inn part-time. She helps make quilts for the inn, and she talked about the inn as their own inn, as Shorefast is ours, and the fishing co-op that we have created since Shorefast is our co-op, and there's a revived sense, or from what I've been told, there's a revived sense of life on the island. They're excited about people coming to see them. Children are staying. People are making investments in the community. And I just saw this as an example of a model of measuring community well-being, which there's a number of publications on it, working in real time. And so I sort of want to look at what is the Fogo phenomenon, I'm calling it, and how do we sort of translate into further northern communities. Yeah. And so my current research, I was trying to be cool. I think I epically failed at it. My current research is titled Towards Best Practice in Arctic Social and Ecological Sustainability, a critical evaluation of community-based monitoring programs. And so I'm evaluating community-based monitoring programs in the community of Pond Inlet Nunavut, Fogo Island, and I'm also happy to announce that I've been developing work with ICC Alaska. That work should be starting fairly soon. Number of consultation meetings this summer, and that's moving forward. And we're looking at sort of how do you have a good partnership with industry or research? What are the elements involved in that? We know that Arctic communities, a lot of them suffer from research fatigue, coming in, being researched, not finding out the benefits of what that project did. And but there's a number that are good, a number that people do embrace and do accept. Communities are excited to continue their work with certain industry and researchers. And so I'm going to begin looking at that. That's as much as I know, because as I said, I'm just within a year and a half of that. And just in closing, I have to admit, it's pretty depressing to look at these models of measuring community well-being and people being so frustrated hearing these the negativity towards a lot of these models and not accepting the consultation process or lack thereof, and hearing about the chronic depression in communities, depression being caused by climate change, not being able to go back to traditional hunting activities, landscapes changing, houses falling into the ocean because of eroding shoreline. So, after months of therapy, I was able to move on. But one thing that, when I asked one person, what is community well-being? How would you define it? And she said, a dream for my community would be to have a holistically healthy community where people are laughing and smiling because they feel good, and where people's basic needs are met and our people don't have to struggle with the past issues of abuse and addiction, where there's an open forum for them to discuss those things. I thought that was great, beautiful, and I wanted to share that with you. So, thank you, merci. Happy Thanksgiving.
Up your slides. I think we might have missed one prior to your discussion of methods. Yeah.
This one?
Nope. Yeah, it was the next one that
Or that one?
Yeah, what you were saying wasn't kind of matching what was on the slide there, so I was No, okay, I'm sorry. I just thought maybe we had missed a slide, but yeah.
Okay.
Can you talk a little bit more about the qualitative interviews that you did with the researchers and some of the comments?
Well, some of the comments from the qualitative interviews. One of the comments that really struck out to me, I think it was interview 7, rather exhausting times we know carrying out qualitative interviews. I said, is there even a point to measuring this stuff? It's so hard to conceptualize, it's hard to break it down. How do you quantify feelings of acceptance or feeling of love or feeling of or depression? How do you quantify it? And the comment was, yeah, you have to. If you don't measure it, you can't manage it. And that really stepped me back a minute and went, okay, it is worth it. It's a struggle, but it's definitely worth carrying this out. I wouldn't say that there was any model that anybody particularly loved. As I said, I felt the Yukon social inclusion strategy was great. It wasn't. The one that sort of seemed to get the most acceptance was the Yukon Gold project, where they're mandated to carry out consultation with the community to find out how a development project is going to affect the local environment. As we know, NEPA does the same thing. And of course, their findings were that it won't affect it at all. I find that a little hard to believe, but it just seemed the most well-rounded. And that's what some people had to say, was that there were quantitative measures and people were consulted within that. Yes.
Were you able to get hold of the model that the people, when you said that you liked the Yukon social inclusion model, and a person commented that they had developed a model? Were you able to get hold of that model that they developed?
Did you
compare it to Yukon social inclusion?
That's a really great question. I did ask to get a hold of it, and I was told that if I wanted to do that, I would need to add another layer to my ethics approval, and I would need to consult with the community that created the model, which would require me visiting the community. And so no, I didn't have the opportunity to do it because there were just too many roadblocks that I didn't allow the time to do it. But I'm still in touch with that person, and I'm hoping that within the PhD work I can actually see what an indigenous model of measuring community well-being looks like. Yes?
It's sort of a cynical question. I'll own that from the get-go.
I love simple questions.
I'm wondering specifically, I'm thinking about report play in the AEDC.
Yeah.
Did they create that model as an effort to measure community well-being? I mean, I guess the cynical side of me says, well, it's like the strategic plan, so they're trying to measure the things that they are planning to influence and to improve over time. Like one of the ones I saw on her plate was number of library visits or something. Well, they're going to renovate the library, and so I'm just wondering your thoughts about sort of a model for measuring well-being as opposed to metrics for evaluating a strategic plan.
Mm-hmm. Well, with AEDC, I think that the only thing that we could really find out from them, according to the publications, was that they wanted Anchorage to be the #1 city to live in America. And so cynicism, I know I'm being recorded, but I think they were kind of picking and choosing metrics that they could get to #1 fairly quickly, maybe, or bend in a way to get to #1. I don't really know, because I'm just going off of what was published. And as I said, it was limited. In terms of a strategic plan, I don't know if it was aligned with any strategic plan in Anchorage. It didn't seem clear to me. It might now, but at that point, no. Yes?
Just as a sort of, I sort of a comment and a question. The comment is that, back in 1995, it's like 20 years ago, more, that we had the Sustainability of Arctic Communities project, which Jack Cruz headed, and of course this was about sustainability, community sustainability.
Yeah.
And that project, we didn't think it was, nobody knows what sustainability means. They don't know now, and they didn't know back then either. So we figured, well, the best way to define sustainability is to ask the communities what they think sustainability means. So we did, and they had this, we had this discussion, and their answer was, well, sustainability is, a sustainable community is a community that's aligned with community goals. So basically they said sustainability is what we think it is. What we say it is, so we asked them what they were, and they developed a set of like 4 or 5 indicators. Yeah. And so we actually did that, and we got in trouble with the scientific community and the university president, because when one of our the community said they didn't want us to actually publish the findings for some of our scenarios using their indicators, which we didn't do it. And we got, anyway, that was like 20 years ago, and it's sort of interesting that it seems that in many ways that project, nobody really picked up on that, and we sort of slid backwards.
Yeah.
And so that, the question is that you mentioned that you have, but it appears that there's a tension between wanting community, sort of complaining about not getting community input or consultation with these models of well-being, and also the fact that there's this impatience in communities that when you look at the indicators that show that whatever they are that show that communities are not doing very well, that nobody's fixing the problems. Everybody knows what the problems are, and nobody's fixing it. There's sort of lack of government commitment. It seems that there's sort of this tension between these two, and so I'm wondering in the sort of in the Newfoundland case in Fogo Island, where you really have a sort of a community developed program from the beginning. To what extent did the community or these organizers, to what extent were they using this indicator process to try to leverage like grants and government funding to do things that they thought needed to be done versus doing it to develop their own vision with their own resources and sort of the hell with the government.
Yeah, and I think that it's a really good point that you make in terms of looking at community consultation. I spoke with more community members than industry, and as I'm moving forward, I'm talking to more industry, and industry says, we hold these meetings and nobody shows up, and then then I ask the question, well, are you picking a time that really makes sense? During traditional hunting and fishing seasons, you're not going to get anybody. We've had experience doing some projects where we're trying to communicate with community members during some very important community activity moments, and you're not getting a great response rate. And I think there's a lot to be sort of teased out from the two sides. And I think the case with Fogo Island, from my understanding of what I've read and spoke to people, is that there is no investment coming from government. Government's not going to give very much infrastructure to it. 2013, I think, or 2003, when this became a registered charity, I think we were in the midst of an election before the Conservative government came into power, in which a lot of money was cut. And so they just thought, we'll create our own charity, and we will work on investments that the community wants, and try to attract those from the outside, and just sort of forget about government. Yeah, but I don't know. It's a great thing that I'm going to look into a little bit more, but yeah, that's my understanding of it right now. Yes?
Did anyone bring up the SLICA data, survey of life satisfaction in the
Did anyone of my interviews?
Yeah, or in your wanderings, did that come up at all?
I cited SLICA in my literature review and background of this project, and within the interviews, I think might have been mentioned once, but it was not something that came up quite a bit. No. Yes.
So this is probably a little bit off of left field, but you're in a way, a step or two away from your research. But I was interested in, being as you're from Canada and have worked with Indigenous communities, if you could touch a little bit on the Idle No More movement, which is a way of empowering communities to deal with the issues that we face as Indigenous people.
I'd say my knowledge on Idle No More is somewhat limited. I know that it came to global attention when the former chief of Attawapiskat went on a hunger strike to get the attention of Prime Minister Harper, which never happened. And she wrote a letter to the Queen, and the Queen ultimately said, I can't really do anything. And I think that what the incredible thing that came out of Idle No More was that Idle No More. Yeah. A lot of Indigenous groups were protesting in Ottawa. I know there were a lot of protests in rural areas throughout the country, blocking roadways, just to try to bring attention to the chronic issues that occur within communities. A calling for a renewed act, because I think a lot of the, I know that a lot of the funding and structure, social institutions that are mandated by the federal government are based on the Indian Act, which is back from way before time. It hasn't been updated. I think that the incredible thing about Idle No More is we finally saw such a large presence of standing up and saying, no, we've heard time and time again about issues, or at least I would say in academia you finally hear about these issues. A great singer in Canada, Gord Downing, who's the lead singer of the Tragically Hip, who's recently been diagnosed with terminal cancer, has spending his last years, last month, weeks, however long is left, to bring attention to issues in the North. He called out the Prime Minister in his last concert to say, we were conditioned through education not to understand what's going on up there, but it's really bad, and we need to address those issues. And so I know that right now there's a renewed effort with the Canadian federal government, with change in leadership, with Prime Minister Trudeau. Finally launched an inquiry into missing and murdered Indigenous women, over 500 cases, where previously when Prime Minister Harper was asked about that issue, he said it's not on his radar, and quote, it's not time to be sociological, which the sociologist died a little bit when he said that. But I'm hoping that there continues to be more. But I think what it did is it brought attention, and especially to a lot of people outside the area. I hope that answered your question. Yes?
Thanks for the excellent presentation. Just wondered if you found any differences between Alaska and Canada.
In what regard? In the models?
Just in your research, in the models and attitudes toward measuring well-being.
Well, I would say that
actual indicators.
from the models that I looked at in Alaska, they were quantitative. Models that I looked at in Canada were largely a mix of quantitative and qualitative. The consultation process, I hate to say, in Alaska was not very extensive or existed at all. In Yukon, it was somewhat there, at least from the literature. Maybe it is happening, just not documented. And certainly it seemed like there were models here that were attempting to address economic concerns, whereas it was a little bit more diverse with the Canadian models. Yes?
I had a question about your literature review. So when you're trying to find literature on these various models, was there much within the academic realm, or was it largely based in news stories, or did you rely on social media pages at all in terms of content?
Yeah, academic papers, no. There really was not very much. No one has really written a paper on what had been said about these models. Google was my best friend. Found newspaper articles, and yes, as well as social media. There are a couple of social media campaigns. I know particularly now AEDC is really working on a social media campaign of I Love Anchorage or something, which looks interesting from different people's perspectives. But yeah, not a lot of academic literature. Newspapers, and as well as the interviews. That really helped because these people were associated with them.
I had one follow-up question, it's okay. In your research, do you have a sense of which models you think are preferred or stronger in terms of being able to collect the data that might be more meaningful from a community perspective, measuring well-being?
Well, I think the gold standard of a model is one that really comes from the community. The community is involved in all stages of the development of the model, and that they have say over how, well, one, what data is shared and what to do from what they find out. In terms of a model where I had seen for this project where that grassroots effort happened, I didn't come across one. I have to say that the Eagle Gold mine project in Yukon did appear to take in more input than others. But as I said, I recently discovered the Fogo Island one, which was astonishing to, but not related necessarily to what I'm looking at. You have a question?
Yes. Related to your content analysis, can you speak a little bit? You have research which had way more sightings than any other terms. What was the significance of that term within the model of the framework? Needed research that had been done? Like how did it relate to them?
Yeah, it was more of a call for research needed to be done. That research was important within each of the models. Further research was needed in order to address the issues. And yeah, it did have a lion's share of responses. And that's again why I called it a experimental, because some of the models were much larger than the others, so there was that skewed result.
We have time for one more.
Yes.
Given what you discovered, what are your thoughts on social indicators and the two of you?
It's a great last question. I think we're out of time. You know, I do believe that it's important. I think that the process that we are continuing to go through of learning what indicators to use, how to measure the frustrations that come from each of those indicators in terms of lack of data. We're working on ways to address that. And I think, yeah, if we really don't know, then there's no way that social issues, local issues can be addressed. So I think indicators that, such as what was being done with the kids count, really showing a snapshot of what was going on across Alaska, really helped frame policy decisions and showed people what was going on. And a lot of things are shocking. We don't really realize that there might be things that are going really well versus other things that we might think are not going so well. But through that process, I think it's important that we continue to work on it, continue to develop different ways. Thank you all very much.
Thank you.